It might be challenging to tell if your child suffers from depression or anxiety. It might be challenging to determine whether a child's tantrums are ordinary or atypical. How do you decide whether your child needs therapy based on their behavior and what kind of therapy they require? Depression can manifest in various ways, including chronic irritation, loss of interest in activities, adjusting food and sleeping schedules, and suicidal or death thoughts. It is deemed excessive when anxiety interferes with daily activities and presents challenges. Moreover, if your child experiences frequent mood swings, disruptive conduct, or is readily triggered by insignificant cues, they may require help. These issues are best treated with behavior therapy, such as cognitive behavioral therapy or dialectal behavioral therapy. Cognitive behavioral therapy looks at the connection between thoughts, behaviors, or feelings and focuses on problem solving. Harmful or unreasonable ideas may cause particular feelings or behaviors in people with depression, anxiety, or ADHD. With CBT, the patient monitors and detects these negative thoughts, checks their realism, and is then challenged to replace them with more positive ones. On the other side, dialectal behavioral therapy is made to help those who struggle with emotional or behavioral dysregulation. Because of their extreme sensitivity to emotional stimuli, these patients react violently to even the slightest events and take considerably longer than usual to return to normal. Mental health problems are genuine and can affect people of all ages, including children. Children are equally susceptible to mental health problems like anxiety and depression. You and your child may be close, but your child may not be comfortable discussing everything with you, which is fine since that is where the therapist comes in. You must acknowledge their need for assistance and give them a chance to be heard. Here are 6 signs your child needs behavioral therapy. To learn more about human psychology, subscribe to our channel because we publish videos on this topic regularly. Please don't forget to like, share, and comment if you enjoy watching the video. Thanks for your love and support, as always. Back to the video now. Number 1. Defiant behavior. If your child is having behavioral issues inside and outside the house, this might be one of the signs your child needs behavioral therapy. Many youngsters express their emotions through negative actions such as arguing, acting out, yelling, or fighting with their peers. Consider whether talking to a psychologist could be a better course of action before disciplining them. These reactions could occur more frequently than usual. Take note of everything. Surprising to you, your youngster is often begging for assistance. Keep in touch with the parents and teachers working with your child daily regarding school and extracurricular activities. Tell them you are worried about your child's conduct and ask them to let you know if they observe any unusually rebellious behaviors. Number 2. An abrupt change in their typical interests and routines. Any changes in your child's regular hobbies or routines, similar to the behavior change, may signify that they may benefit from counseling. It is frequently the most obvious and probably the most helpful sign. If these changes last longer than 2 weeks, consider making an appointment with your child's doctor. They might be able to direct you if they think emotional issues are involved. Number 3. Excessive melancholy and concern. Excessive worry and grief are the most evident indications that your child needs assistance. Although melancholy and anxiety can be acceptable feelings, especially during times of change in life, excessive sadness and worry should be seen as a warning that your child needs support. Because children prefer to keep these things to themselves out of embarrassment, you might not know if your child is being bullied, experiencing issues at school, is grieving, or is going through any other emotional condition. But if these things cause exceptional anxiety, extreme melancholy, loneliness, sobbing, or worrying, you can always work it out as a parent. Number 4. Regressions. Regressions might happen when a sibling is born or when there are significant life changes. It's worth investigating why it seems to occur for no apparent reason. Some typical signs your child needs behavioral therapy include frequent tantrums, separation anxiety, fearfulness, and extreme anxiety. Number 5. Social isolation. Isolation from classmates, the environment, and perhaps even the parents is a red flag for any problem. Additionally, you should observe your child avoiding social situations. When they are worried or depressed, kids frequently avoid social interactions. If this occurs regularly and damages their interpersonal connections, it is time to recognize that it may be more than just a bad day. Number 6. Self-harm. Last but not least, you should seek quick assistance if your child has thoughts or feelings of harming themselves. This can occasionally be subtly present and accompanied by emotions of loneliness and powerlessness. Suicidal thoughts or cutting can sometimes be more overt signs that it's happening. Suicidal ideas or cutting may seem excessive to younger kids. Self-harm, however, can take many various forms. Young children who self-harm may strike themselves, slam their heads against objects, or stab themselves in the flesh. You should immediately take notice of any self-harming behaviors in your child and seek care for them. Children frequently experience confusion, sadness, or frustration in trying circumstances. They might not, however, be equipped with the required coping mechanisms to manage these feelings. Children could find it challenging to deal with stressful situations and life upheavals on their own. If your child appears to be struggling to adjust to significant life changes, like a divorce, a move, a change in schools, a death, the arrival of a new sibling, or even a breakup, consider seeking additional support. These are 6 signs your child needs behavioral therapy. Did you find this video helpful? Do let us know in the comments section below. If you enjoy watching the video, please don't forget to like the video and subscribe to the channel. Thanks for watching. Have a good day.